It was a pretty straightforward path in terms of my diagnosis and the treatment options. So she laid out a plan that was initial chemotherapy and radiation, followed by surgery, followed by more radiation, or followed by more chemotherapy.
Had done 12 chemos of the full FU5, then went a year, somewhere a year, maybe a little bit longer, and then started on another regime, which went on for another 12 injections. So I have had 24, 25 injections in total.
The meeting with the colorectal surgeon really didn't give me so much treatment options. She just said, here's what I suggest. My tumor was right at the break between my colon and rectum. And so treatment for both is different. She said had the tumor been just 1 inch higher, she would have had me in surgery the next day. But being where it was, she suggested chemo plus radiation first to shrink it.
The local doctors wanted to go the chemo way. And I felt that the chemo would be, in a strange way, the chemo was less invasive than the surgery. Give me the chemo and we'll see how this goes. With surgery, they cut you open and you don't know what's coming out the other end. And so I was told, and I was advised that the chemo generally didn't work with this. But from the best doctors around here said it'd be worth a shot. We could give you the chemo that would apply for your typical colon cancer. Because the appendix was attached to it, it might work.
The only option was surgery. It was like we need to do the surgery, which was fine by me. I'm not a squeamish person. It's like, okay, it's what you want to do. Let's do it and get it over with.
I was presented with, should we treat you as stage 3 or should we treat you as stage 4? And it was hard. I was sitting there like, ask me a marketing question. I can answer a marketing question for you, but I don't know. Like, you guys are supposed to know this stuff, not me. And there was, there's pretty drastic differences between stage 4. They would use a drug that was more systemic, and with stage 3, they were going to use something different. I honestly can't remember all the details now, but I just remember vividly knowing. And there's also side effects. Nothing's black and white in medicine. I found there's always gray area, and that's what's so frustrating.
My oncologist said that, Mark, you have 3 choices. The first one is hospice slow, hospice fast. I didn't quite know what that understood. And you'd mentioned you had a surgeon down in Southern California that you've been in contact. I think you might want to consider that now. And we were all a little reluctant to do it because the surgery itself was brutal.
When she laid out the treatment options, I was shocked. I mean, it was, it was a pretty large tumor, and it was, fairly late stage cancer. And so just the fact that I had to go through, radiation, I didn't know what that meant, or, I just think nuclear, when you talk about radiation. So it was shocking that, the surgery itself is uncomfortable to hear about and imagine. It's colorectal cancer. You're going to be having a lot different vocabulary than you're used to. And then you ever thought you'd be talking about at 39 years old. So it was all incredibly shocking.
I instantly was very much at ease with my colorectal surgeon, so how I felt about treatment, how my approach to it was simply, okay, this is what we have to do. I didn't really need to hear more on what other potentials, because this was the strongest recommendation from my colorectal surgeon, and since I had already felt very comfortable with her, I didn't feel I really needed to explore more periphery treatments.
I felt completely confident that my doctors knew what they were talking about, and that it was a proven treatment, and that I would do whatever it took to do the treatment and to complete the treatment.